Dear viewers, I hope you are all fine. This ultrasound video shows multiple cases of about 3 cases of ureteric stones. You can see the right kidney. It shows moderate to severe hydronephrosis with the hydroureter. Now you are going to see the focusing of the ureteric stone. The focusing of the ureteric stone requires a bit of probe handling, and you can use the color Doppler to differentiate between the blood vessels and the ureter. You can see the ureter in its upper one third. Now the ureter is crossing the iliac vessels. Now after crossing the ureter, the middle one third of the right ureter is visible. And again you can see the blood flow. There is no blood flow in the ureter. You can use it to differentiate between the blood vessels and the ureter. This is urinary bladder. This one is the right ureter. Right ureter in its upper one third. And now you can see the stone. The stone in the lower one third. In the distal portion of the ureter, a large stone is visible near the ureterovesical junction. This is right ureter, and this one is the stone. You can see the stone shadowing. Larger is the stone, greater is the intensity of the hydroureter and hydronephrosis of the kidney. And the stone nearer to the kidney shows greater and gross hydronephrosis as compared to the stone in the lower one third. Now you are going to see another video. Now you are going to see the other video showing the ureteric stone. This stone is smaller as compared to the stone seen in the previous video, so the intensity of the hydronephrosis and hydroureter is smaller as compared to the previous video. This is right kidney, liver, Now you can see there is minimum iodoureter due to the stone lying in the distal ureter, in the lower one third of the ureter, and the size of the stone is also small, so the iodoureter and iodonephrosis is less. This is the right ureter. The ureter in its upper one third. Again, you can use the color, the blood flow to differentiate between the ureter and blood vessels. This is right ureter, and as it is crossing the iliac vessels, in the middle one third of the ureter, now you are going to see the lower one third of the ureter. Bladder, urinary bladder is also visible. This is urinary bladder. And now you can see the lower one third of the right ureter, and you can see the stone. In fact, there are two stones lying near to each other. This is the stone, and this one is the right ureter. Now another stone, smaller stone, lies close to the ureterovesical junction. Again, you can see the right kidney. This is the stone in the ureter, and another stone lies just very near to the ureterovesical junction. This is right ureter. This is right kidney. And this stone measures about 8.0 millimeter, and the smaller stone measures about 5.9 millimeter. Now you are going to see another case of ureteric stone just after the conclusion of this video. Now you are going to see the third case of focusing of the ureteric stone. You can see the right kidney, and there is a small renal stone, and the kidney shows hydronephrosis with the hydroureter. There is mild hydronephrosis, and you can imagine that the stone might be small in size, and or it may lie in the distal portion of the ureter. Now you can see the upper one third of the right ureter is a bit difficult to focus because the intensity of the hydroureter is less. This is the right ureter. And now the ureter crosses the iliac vessels. This is the right ureter crossing the iliac vessels. Again, you can use the blood flow to differentiate between the ureter and the blood vessels. Now you can see there is no blood flow seen in the right ureter in this case. Now you keep on focusing the ureter by sweeping the probe downwards towards the bladder, and again you can see the lower one third of the right ureter. A small amount of urine is seen in the urinary bladder. The patient is not well prepared, although the urinary bladder must have enough amount of urine, but sometimes one have to examine the patient. Patient cannot hold the urine, and now you can see the stone in the lower one third of the ureter. I advise you to please examine the patient with full bladder, but there are conditions where a sinologist have to examine the patient with minimum amount of urine seen in the urinary bladder, as the patient cannot hold the urine due to the intensity of the urinary tract infection. Now the stone is clearly visible. Thanks for watching. Please subscribe my channel, and if you do like this video, please click the like button. This stone measures about 8.2 millimeter. Thanks for watching. Thanks.